Hello everyone, and thank you for joining us for this episode of the Can You Hear Us podcast, where Suzi and I are going to be filling you in with everything you need to know about our upcoming campaign work for the NF2 community. So first of all, Suzi, please could you introduce yourself to the NF2 community and tell everyone about your role within the Can You Hear Us team?
Yeah, sure. I mean, first of all, thank you. It's a little bit weird being on the other side of this. So, anyway, I'm really happy to be here chatting about the campaign goals today. I'm actually an NF2 myself and also a member of the Can You Hear Us team. So, some people that see me might know me from my adventure days. But my main interests are in psychology and research. And my role at Can You Hear Us kind of accommodates quite a lot of things, but the official role is as an engagement officer. And what that means really is managing how we engage with stakeholders and how we engage with the NF2 community. Now, Can You Hear Us has been doing this for a really long time. And so my role is looking at sort of really formalising some of that research work and ensuring that our work is really driven by evidence and importantly by the community. The main element really is around communication. So whether that be through social media or through clinical communication or with our podcast, it's really about engaging in some form of another and enabling Can You Hear Us to be effective, transparent, and to meet its purpose.
I know from the offset, Can You Hear Us was given its name because it intended to be a voice for people with NF2, and we've really achieved that in so many ways. Because soon after the first book was published, we also expanded to other areas like social inclusion and peer support, which became our most active areas of work. Now with our rebranded structure, we want to bring patient advocating to the forefront of our work again. So the question now is, why is Can You Hear Us doing campaign work? And how will this benefit the NF2 community?
Well, that's great. I mean, because like most organisations, we've had to evolve with need. And the NF2 ecosystem is constantly changing, and we have to make sure that we're actually meeting a need. And it's been amazing to see and be part of some of the initiatives that Can You Hear Us has led, and it's been even more brilliant for me to see lived experience at the forefront of that. We've been using that word quite a lot recently, and since the rebrand, we've been using that word very prominently. And it's a bit of a buzzword, if I'm honest with you. And many organisations will provide a platform for people with lived experience, but very few are actually led and managed by those with lived experience. Now, that's not really exclusive to NF2. That's something that we see across most minority groups, sadly. But we wanted Can You Hear Us to magnify actual experience, in a way that informs the services that we as NF2s use. So this is really important because our goal of advocating those experiences is for the purpose of change. And that really is what will be the foundation of our new campaign work.
So it really is giving a voice, isn't it? By going up further with it, by saying we won't shut up until things change.
Well, yeah, in a way. And that consistency is really important, actually, to ensure that we are working with clinical services in a positive and constructive way. And real change takes time. And it's never a case of, right, we want to see this happen, then boom, it changes overnight. Change doesn't happen without reciprocation. It doesn't happen without collaboration and a relationship. And that's why, it's really fantastic to have clinical teams like we have that are really keen to hear patient views. They're really keen to understand lived experience. So that's really, really fantastic for progress going forward, you know. And I think from an organisational point of view, it's really important to recognise our own position in the NF2 ecosystem, because if all of us, all these organisations were focusing on the same things, then everyone will just end up reinventing the wheel, so to speak. And, you know, we're one of 3 patient representation organisations working with the NF2 service and with NHS England. And so we provide these updates and feedbacks to their service, but others also do that. And, you know, in the UK, we have the Red Sea strategy. And what that means is coordinated care for rare diseases. Their services have to partner with like a partnered organisation, usually that's third sector, whose representation for patients. And so the main partner for that is NF2 in the UK, and that's where they come in, you know, and they mostly work around clinical support and fundraising for really vital outreach work across 3 nerve tumour conditions, including NF2. And of course, then the third patient representation group is the new NF2 Biosolutions. And of course, they're fundraising arm in the UK for the global initiative to find new treatments and possible cures for NF2. So each of us are doing our own vital work in the community, but each of us have a different purpose.
Absolutely. And I think that the NF2 community is very fortunate to have so many people and organisations working to support them in every way. Then maybe there needs to be a bit more clarity about what people can expect from each representative.
Yeah, definitely. And, you know, in my experience, I've worked in the third sector for 10 years now, and this is a bit of an issue in that sector. You know, the community in the context of NF2, the community is really small. So services tend to be really diversified, and they offer quite a lot, and that's really good in one sense. But yeah, it definitely causes a little bit of confusion. And as you know, for us, our work is to provide a space of peer support and social opportunities for NF2s to meet each other, and also to understand and communicate the needs of the NF2 community we work with to NF2 clinical services and stakeholders. We do that in a number of ways. You know, particularly now, our gatherings have gone virtual, but that's one of the ways we connect NF2s together. We also have our network groups online that help people just meet others virtually, you know, without the pressure of that face-to-face interaction. And quite regularly in those network groups, we will see people talking about different issues, and sometimes these issues will come up and people will have questions about particularly things related to NF2. And really what that shows us is if somebody is asking for information, it means it's not elsewhere easily for them to be able to find. So it's quite logical, really, in our perspective, because if there's a lack of information, that's what needs to be addressed. And so this is one of the things that prompted us, you know, to focus a little bit more on problem solving and advocating. And our role is not necessarily about devising an answer ourselves. It's about sourcing one, you know, and it's about having ongoing communication with NF2 service so that we can provide those answers, or at least signpost in the right direction. And also there are some issues, quite a lot of them, that NF2s face that aren't exclusive to NF2. So you see things like pain, migraines, neuropathy, and these things are actually experienced by other conditions as well. So actually it means we don't always necessarily have have to look within the NF2 ecosystem to be able to find answers. So it means there's a lot of scope to be able to find information for people, because also there's not a huge amount of information available for people with NF2, unfortunately. And if you think about neuropathy as an example, you know, these issues are so wide-ranging and they affect people in so many different ways. So you have to pick apart as much information as you can find around there, really. And, you know, if you think about rare disease as a whole, and one of the reasons that we look to other conditions as well for potential crossed over information is, you know, historically, if you look at the term rare disease, actually the very first term was orphan disease. And quite crushly, actually, it was coined that because pharmaceutical companies used to use the term orphan drugs. What that meant is that the numbers of people who would get treatment from a drug or benefit from a drug was actually too small. And so people weren't likely to fund it. And so actually it doesn't make the pharmaceutical companies any profit. So what that means is they don't make it. So it got grouped into orphan drugs. Then campaign groups started taking that term on and they termed it as orphan diseases. And this was really, as it has evolved over time, then become rare diseases. And my point really in explaining all of this is about the whole theory of strength in numbers and really justifying why we can't always just look to the NF2 ecosystem for information. Because, you know, we see even in the modern day version of campaigning, you see the Rare Disease Alliance in the UK. Now you imagine all of those organisations trying to campaign themselves, trying to get funding, trying to get their political agenda on the cards. If they do that individually, it's less effective. And actually, if they all come together, that means it's more effective. And we've seen the evidence of that because of new policies and the way that things are implemented. So it's really important that we don't just necessarily rely on the NF2 ecosystem alone for information or the sources of information anyway. So that's really, I mean, we're very lucky to have coordinated care in the NF2 context, you know, and that's been a hard one by a lot of campaigning. So that's been really important. And many rare diseases don't actually get that coordinated care. So again, really to the point of strength in numbers and to the strength of looking outside of the NF2 community to also give us extra foot in information.
Yeah, I do remember the days before coordinated care, and it scares me a bit to imagine if things are still that way, and I think a lot of people can relate to that.
Definitely. And I mean, you know, the key point really is that the world is full of information, and the likelihood is that if we see a question that's posed in our community, there will be an answer somewhere. It's just about finding where that is. And sometimes that process of just finding that information is too complex, or it's just too much hard work for people. And sometimes that information is also in academic speak, it's in medical speak. So it's about trying to find ways to translate it. So it's one, easy to read, two, easy to understand. And you know, also if you think about where we get information, so there are some issues, some psychosocial issues particularly, that may not have answers within the NF2 service because obviously their remit is around clinical support. Also their research is around clinical support. So looking at some of the issues that are a wider impact of NF2, you just have to go outside of it sometimes.
If we can't source an answer, then we'll do our best to signpost NF2s to people and organisations that do have an answer, right?
Yeah, that's exactly it. You know, I mean, regardless of whether there's treatment available or whether there is anything that can be done to completely solve the situation, there is always going to be someone that's experienced what you've experienced in some way or another. And so sometimes it's a case of just connecting people. It's just a case of being able to say, okay, well, actually, there are other NF2ers that have experienced something similar. Have a chat with them, find out what their experience is about. And this is one of the really important things about the network groups online, is we see very regularly people talking about their experiences, sharing their experiences, and also people asking questions. Has anyone had an experience of this, and this? And it's great communication for people, and it's a great way to be able to access and not really feel like you're the only one experiencing that, you know, and you know, without having to think, oh, I don't want people to judge me or whatever, you know. And sometimes when you're a family or a member or a partner, you don't have that same access to that experience. So the conversation sometimes needs someone with that expertise, whether that be lived expertise or clinical expertise. Excuse me. And we have to remember as well, you know, is the clinical services themselves, they're set up for a very specific purpose, and they're funded to meet certain outcomes. And this is where you'll see things in clinic like the quality of life measurements that we're all used to filling out when we go to clinic.
Oh, they are rather boring and frustrating, aren't they? People often seem to feel like there's somewhere in between the options that are given, but still they're an important part of our care.
Yeah, definitely. I mean, it really helps the clinics in a number of ways, because one, importantly, it helps them to identify patients who may be experiencing, you know, significant distress. And then on the other side of it helps the clinics to evidence that they're having an impact, and that actually, you know, their services are working and it's having an effect and improving quality of life for people. You know, and they measure a number of different things within the service. That's just one of them. You know, they also measure levels of hearing preservation within the service. So, you know, they'll report things like, let's say 60% of our patients have, you know, restored X amount of hearing function, because there are certain things that the services are set up to do. So, you know, those things are their core services. That's what they're called. And so it's easy to forget that services can't do everything. You know, they can't meet every need in the community. And, you know, that's why patient empowerment is really important. But they do have certain services, which is, you know, the outpatient service, also NF2 testing, hearing rehabilitation, preservation, surgery, any drug treatments. And so anything outside that scope is not really a core service of theirs.
Yeah, which is so much more than any other country has.
Yeah, definitely, you know. And also, you know, if you think about the UK service or the England service, it receives somewhere between like 5 and 10 million pounds of funding each year for this service. And, you know, it sounds a lot, but actually with a caseload of 1,000 patients, it introduces a lot of limitations. You know, so what this means is to have the ability, the clinics, I mean, to have the ability to communicate to patients is a real advantage. And also for us to be able to communicate patient needs to the clinic as well, it just really helps them to have insight for one, and also to use that information in efficient ways. You know, and that benefit is two ways. So we communicate with them, but also they can use us to communicate with patients as well.
Yeah, I can back up that point, as there have been a couple of occasions over the past years when no specialists have come to us for ideas about what the NF2 community could benefit from. But we haven't always really been in a position to provide them with answers.
Yeah, and it's funny because sometimes we see the NHS as this sort of all-encompassing machine, and excuse me, you have to remember that there's like small stuff, that there's more logistical issues that the clinics will face. So, for an example, if you wanted to create a walk-in video to show patients the experience of clinic, then there's quite a lot of things that you will face, or a lot of potential barriers that you were facing in that. So, you've got staff time restraints, you've got possible media restrictions that are imposed by the trust of the hospital itself. You've got consent issues about, is there anyone else in the room? If there's people in the video, every single one of them needs to give consent, and it's it becomes a consistency issue as well, because all trusts have different rules, different policies. So imagine that one clinic had the capacity to create a walk-in video. It's super helpful for the people that use that clinic. But then it's also seen by other NF2ers, and maybe those other NF2ers will look at that video and presume that the process is exactly the same across all services, and then they arrive and the process is different. Maybe you're then creating new anxieties, and actually, there's a lot to consider all in these. And then on that side of things, it becomes an ethical issue, and the NHS has some of the strictest ethical processes, and so it very quickly becomes kind of a very difficult task to achieve, really, and then once the video is created, think about, where's it going to go? Where's it going to go? Is it going to go on the trust website? Is it going to go on the web page for the clinic? Who updates that? Who funds it? So this is where partnerships in the community become really beneficial, because it can allow clinics to really disseminate that information in a more effective way.
Oh, this is really interesting to hear, and it makes so much sense.
Yeah. I mean, notice boards, that's a really a good example as well, because we spend a lot of time when we go to clinic sitting in a waiting room, and that's an ideal opportunity for us to have a nosy around at the notice boards or have a look at the information racks, and it's a really effective way sometimes to be able to communicate with patients. But the problem is NF2 clinics are housed in other departments, so they don't necessarily get use of those spaces. And again, really, information is power at the end of the day, and I use power as a neutral word, but in terms of the NF2 community, really, that information is about empowerment.
It's a really good point. Could you give us an example of that?
Yeah, okay, so recently we've seen a big uptick in people talking about neuropathy, and of course, a lot of migraines. It's all encompassing. There's lots of different dimensions to it. And unfortunately, there's not an NF2 encyclopedia that sort of says, well, if you experience this, this, and this, it could mean you're having this, this, and this, So everyone is so different in the way that they experience things, so that itself would be a really difficult thing to do.
Yeah, so true.
And I mean, one of the things we can do, though, is provide simple, easy to understand information that's, not full of medical jargon, and it just really simply explains what is neuropathy, how can it affect you, and it may be that neuropathy has a unique causation within the context of NF2, But as I was saying earlier, it's prevalent across other conditions as well. You know, you look at elderly patients or patients with MS, you know, there's a lot of similarities there. So there's lots of information available, you know, and treatment for neuropathy it's not always necessarily provided by clinics either. So they can act as a really great referral tool, and in the hope that, you know, you can achieve some good outcomes. Sometimes going through your GP or your primary care provider can be a really, really slow haul, you know. So increasing that knowledge about what neuropathy is and how it can affect you, well, actually that's increasing knowledge for the patient, and it reduces anxiety, which is caused with the uncertainty of the experience, because it actually can be really scary, you know, and it helps to prepare people better for clinic. So, you know, if you want to go and be super pragmatic, you might seek private support, you know, and you want to be armed with the information to be able to decide if that's right for you. You can do that, you know, and also when you go to clinic, to be prepared with the information so that you can have your questions prepared. You know, you can have a nice objective conversation with your clinicians as well. You know, for me, I've had neuropathy issues since I was first diagnosed, and that was like 15, 16 years ago. Some of it's manageable, some of it's treatable, others not so much, you know. And the clinic's role is really helpful to identify why has it happened, what's caused it, you know, and sometimes that means they can refer you for treatment. Sometimes it means, you know, just working with an OT or a physio to manage the symptoms. The point really is, unless we know this, how can we feel in control of our participation in the whole process? And that's really the core of empowerment, you know. It's really about participation.
Yeah, totally. You're right. People get hit with new scary words, and then the brain kind of gets flooded with emotion, and then it's difficult to like focus on what's been said after.
Yeah, oh my God, that's just absolutely just yes. You know, I really believe that it's totally understated in our understanding of the dynamics between a patient and a physician. And it's not always as simple as just having a totally objective and clear-headed conversation about something that's affecting your everyday life that you have no knowledge of yourself, because you're not the expert and you haven't had access to that information. And, you know, one of the other benefits, of course, is it's really twofold, because with more knowledge, patients feel more in control of their health. They're able to arm themselves with questions. They've got the foundations of the understanding to be able to ask questions to clinicians and really be involved in that conversation. And that's really important to informed consent as well.
Yeah, that makes a lot of sense. Could you now give everyone an example some of our campaign goals are and what inspired them?
I mean, as you know, excuse me, I'm a phenomenological researcher. What that means is I'm interested in experiences, lived experiences of people. So one of the things you and I went through last year was, how can you hear us communicate and advocates the lived experience of NF2. What we had to look at really bluntly was, you know, exactly what we wanted to try and achieve. And for us, it seemed pretty straightforward. You know, if you're going to understand and communicate lived experience, that needs to be the sole purpose of your work, particularly the campaign work. So we removed all the background work, if you like.
Yeah, things definitely much clearer now, but there's much more focused practice.
Yeah, definitely. And you know, that's one of the impacts of having real clarity. And you know, it wasn't a case of prioritizing campaign and research work over our community work. It was more a case of creating an engine, you know, because they both feed off of each other. But really, the main thing for us was we needed to formalize the pathway in which we communicated the issues that were affecting the community that we work with. So that's really where it all started, you know. And another thing for us as an organisation is transparency is really important to us. And, you know, for me, with my background in research, you know, I've been taught you always have to have a starting point. You can't build anything without a foundation. And when it came to our campaign work, we didn't really have that starting point, not in a terms of empirical way anywhere. We had ton of anecdotal testimony. You know, you just have to look at our books as an example of that. But in this context, because lived experience is so under-researched in NF2, you know, there's no papers out there that talk about it and assess it in that empirical way. And so we knew at that point, if we were going to be more successful in communicating to the clinical services about lived experience, that we needed to do that in their language. We needed to do that in a way that was translatable to our medical provision, really. And that's not to say that clinics don't listen to anecdotal testimony. It's just a case of more of how you can present that as evidence or not.
We're kind of wearing it.
You know, I think in terms of it, it's just a different approach, you know, because we've, as an organisation, worked so hard to share experiences from NF2ers, to give them a platform to be able to share those experiences. But from an empirical side of things, you know, I'll give an example. So within the research departments in hospitals, most people will have a research contract. And if that contract is in place, then officers can focus on clinical issues. And if that research contract is not in place, people are doing it in their own time. So of course they're going to focus on their specialisms. So what that means is there's this huge gap in lived experience research, you know. One of the things for us that we were interested in was understanding, well, actually, how do NF2ers experience the clinics themselves? You know, and again, looking for that starting point, we didn't have one. You know, there's no published data on patient experience within the clinics, you know, and so we felt that actually that was really important as a starting block for us, because if we don't know how people are experiencing it, how do we know what they need advocating? How do we know what we need to campaign for? So earlier I mentioned about how us as organisations have to be evolving, you know, but actually clinics aren't really immune to that either. You know, if you imagine thinking about the advancements in NF2 care since the coordinated care started right through to modern day, you know, it's not the same. You know, everything's innovated and there's lots of things that evolved. And so it would be crazy to think that the service provision itself would stay the same. So we wanted, again, really just to understand what people's experiences were, because if we're going to start campaign work, we need to see if there's a need. Is there a need for us to campaign? You know, because there's no point doing work that there's no need for, you know, it's just going round and round in pointless circles. And so we put out a survey last year, and the point really was to help us understand, is there an issue we need to address here, or is it all plain sailing, fine and dandy, you know. And when we initially, well, before we took that step, we were looking at what data was already available. We tried to look at what the clinics themselves measured, and really in terms of experience, the only thing they really did at that point was the quality of life measurements, you know, but that didn't particularly answer the question that we were asking. And, you know, we wanted to know people's actual experience of the clinics rather than the experience of the condition itself.
Yeah, other than knowing things from my many discussions with you and I have had with fellow
Yeah, definitely, you know, and I think
experiences, we see this pattern where people only tend to compliment the service because they don't want to feel ungrateful. But when we speak to each other, we often have quite a lot to go off the top.
yeah, definitely. It's a really good point, actually, because again, if you think psychologically about how, as a patient, we interact with clinical teams, you know, just think about the impact these clinics have on our lives. You know, it's undeniable that we stay alive and that we manage life because of their support. Now, the challenge with that is it can create this kind of all-encompassing gratitude, which in itself can sometimes be harmful, really positive, but can also be harmful. And what this can result in on a sort of research side of things is something we call positive bias. And what happens is when a participant of research, and that's really the NF2 patient filling out the quality of life, and whatever other, you know, surveys there provided, sometimes it means people will respond more desirably than they will truthfully. And so you don't always get the full picture. Now, the scales they use are completely validated, so the information is really well collected, but it doesn't take out the variables of how the participant or the patient is actually responding to those surveys. So, you know, there's lots of things as well, you know. For me, I end up always completing my quality of life when I'm at the clinic, you know, and I know they post them out with your appointment letter, but do I always remember to fill it in? No. I mean, I might have work on, might be other things going on in my life. I might fill it out, but forget to take it with me. I might fill it out, but actually on the day that I'm there, I feel a little bit differently. And you know, so if I turn up in clinic and then I'm giving another survey, then I'm already anxious when I've arrived, because for a lot of times clinic is quite an overwhelming experience. So I've walked into the situation anxious. I've been given this quality of life form, and you know, it can just add to a little bit more overwhelm. And also we fill these out every year. I mean, sometimes I go for clinic a number of times a year, and actually I must fill it out pretty much every time I go, and this can cause research fatigue. So actually I don't really pay much attention to it, or I don't really respond as in depth as I could, or as honestly as I could, because it's like tick, 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 you know, get it out of the way. And you know, there's another thing that kind of you add on top of that, and not everyone experiences this, but some people do. And we've seen people talk about this before, you know, is if you go back to that all-encompassing gratitude, these people save our lives. These people have such a positive effect on the way that we have the ability to manage our health and our healthcare. And so you almost want to be a good patient. You want to be maybe a bit more positive in your responses, because maybe, you know, they use that as a measurement, and maybe you don't want to be seen as you know, the person who's having a more negative impact, and you don't want that to be badly reflected on the service, because we will remember the days before coordinated care.
Yeah, wow, it's such a complex issue, isn't it? I haven't explained like that. It was really eye-opening and actually also really relatable, I think, to many people.
I mean, you're right, it's really complex, and there are so many variables that can impact the responses. But I mean, regardless, like I say, it's a validated scale. It gives really important information. It helps clinics to be able to identify people in significant distress, and also largely it works, you know. So I'm not saying in any way that it's a negative process. I'm just highlighting that when you do research, there's lots of issues and there's lots of different perspectives of looking at things as well. But going back really to when we first looked at the idea of doing campaign work, the quality of life wasn't appropriate to give us an answer to what we were trying to find out. So, as I mentioned earlier, one of the things that we did was we put out a survey. And the purpose of the survey was really to understand patient experience, specifically in the NF2 clinic. So we created the survey with key domains of patient satisfaction. And that included a couple of items that were likely to be a bit more prevalent in terms of service support or provision, and particularly if you look at communication support. And I think one of the things that we wanted to be really transparent about in the report as well, and if you've read it, it's really, really open and it's available on our website as well. But one of the things that organisations who work within a specific community quite often fail to do is to understand who are they working with, how many people are they working with, what are the demographics of my community, what are, how do we know who we're reaching? And that's not just applicable to us, that's any representation organisation. So what we did as part of the report on the survey was we calculated the percentage of the possible UK NF2 population, and then we looked at what percentage of that population do we currently work with. And as far as I'm aware, we're the only ones that have done that or published that information specifically. And the reason this is important is not just because our stakeholders need to know that we represent hundreds of people. And for the sake of transparency, it also helps us. And it helps us to know how many NF2ers we are reaching. And it helps us to assess the methods that we're trying to reach them. Are they working? Are they not? This is really vital information for that. What it also does, it looks across the ecosystem for NF2. So who's reaching who? You know, you have 3 patient representation organisations. If we know how many we're reaching, but we don't know how many other people are reaching, we then don't know how many people are relying on the NF2 service for all of their information. So it's that accountability. And for us, when we looked at the campaign work, and particularly when we wrote the report for this survey, and the research that we did, it's about not just saying, oh, according to our research, these are the key areas of the NF2 service that need improving, you know, but on the other hand, if there are 1,000 people in the UK that have NF2, and collectively we're all reaching a certain amount of numbers, again, it goes back to we don't know how many people only rely on the service from the NHS. And so for us to make sure we included that within the report was really, really important, you know. And I think really, I mean, I'm a bit of a data nerd, but it seemed quite a logical thing to kind of know exactly who you're working with.
Yeah, again, it's really hard to formalize things in this way. Otherwise, you're kind of running blind.
Yeah, and I mean, when you're in the thick of things and you're working really hard on projects or you're working really hard on campaigns, it's really hard to see the bigger picture. And I think, you know, we decided very early to take a systemic approach to it, because we wanted to understand not only what we're doing, but where we fit in terms of what other organisations are doing as well. Because, you know, you see too many times in the third sector, you have different organisations and they're all trying to do the same thing. What a waste of resources. So we don't want to just be mimicking other things. We wanted to do something that was different, that reached people in a different way. And that was really important to us. I mean, I've been part of the third sector for over 10 years now, and it never ceases to amaze me how some organisations just have no idea where they're positioned within their ecosystems or within their industries. And you know, it's really important to understand what the other actors in the community are doing, what their goals are, how they reach people, who they reach, how many they reach, what methods they use. And, you know, it's not important just for us as organisations, but, you know, for communities as well. Campaign work. The results that came through, you know, as I say, you can find the report on the Can You Hear Us website. And some of the things that came through were really expected, you know, and they showed a lack of consistency across clinics, which, you know, not really surprising, because clinics themselves can all, they sort of agree in principle about what the core services are and about what they offer. But each of them are under a different hospital trust, so there's lots of things that aren't within their control either. But it's disappointing because, you know, it sort of speaks to the whole postcode lottery thing.
Yeah, that's so true. And I noticed a kind of pattern. I haven't been in contact with so many other NF2s in the country for several years, but to have it hard evidence is how we can actually take action.
Yeah, to be honest, it was a little bit surprising to me before I sort of researched it all, and if I'm really open about it, because I had an assumption that all services were the same. I didn't realise that they were, in their own ways, quite different or a little bit different. And I felt silly about that, actually, when I had that realisation, because it wasn't actually until I moved from one clinic to another that I experienced that difference for myself, you know, and you're right. How do you even start to take action on that? Is it even possible? You know, and these were important questions for us. And it wasn't like we were going in fully in a China shop loud and saying this was wrong, you know, because the NF2 service, they're looking for feedback. They genuinely care about patient experience, and they're genuinely committed to the cause of NF2. They want to understand and meet patient needs.
Yeah, I believe that too.
I think for me, one of the things that was really interesting was the results brought up a lot of expected issues, you know, and it brought up a lot of things that we see people discussing within the community. And you know, there were quite a few of the issues that came up that were already being addressed by the clinical teams, you know, so there was so much of it we don't need to do anything about because they've already got it sorted, you know. So one of the things that we did is we looked to narrow it down to, well, there were two key issues that for us we felt were significantly impactful for lived experience, and that we didn't feel from the response that we got on our own experiences that enough action was being taken on. And so those two subjects were communication support and psychological support.
Yeah, it's great that we're addressing a more practical sort of issue, and then an issue that focuses on the ongoing side of us. Yeah, the two can be entwined.
Yeah, and that overlap is really important actually, and it really links the two issues together quite nicely. So when you think about access and shared decision making, informed consent, all of these things go together with patient empowerment. And there's an abundance of literature additionally around mental health, psychological distress with long-term medical conditions, and these things can also present in physical ways. So it's well documented even by our own physicians and clinicians in their own research how prevalent mental health is within NF2 and how many NF2s experience mental health issues. And so I think for us it was a bit alarming to see, I don't want to say a lack of response, but I mean a lack of coordinated response really. What we're seeing, particularly around the subject of mental health, is people either not seeking help because they know it's not accessible for them, or not knowing where or who to ask, not knowing if their NF2 team offers psychological support, how to access it, what support is available, how does that support help them. There's so much that can be done in this area.
It's a sad situation. Actually, I'm a member of NF2, you were not aware. I'm a psychologist on the NF2 team. So I can actually see that happening. And I think it must be difficult for teams. Maybe they worry about pushing in people's faces and it might be best to allow patients to reach that point where they feel confident to ask for that kind of support themselves. But I've seen people with NF2s and non-NF2s not ask for this type of support until they're really critical stage with their mental health. And I really don't think I should have to get to that.
It is. I mean, it's a pretty big issue. And I think, like I was saying, stigma is a real thing. And if you're experiencing mental health issues, you have got a whole load of hurdles just to get to the asking point. So what we want to do is make sure that asking point is within reach, it's easy to access. And I mean, mental health services largely fail people with additional needs. So there's real scope for the clinics to provide this. I mean, like I said earlier, if people have had community access to therapy with communication support provided, I'd love to hear from them, I mean, for us, we're really lucky here in the UK because we have some of the leading advocates in the world for NF2, and they're right here in our services, and I think particularly I look at it from my perspective, there's so much emergence of research coming out around medical trauma and medical PTSD, and it's potentially really groundbreaking stuff for NF2 care, and all of it has major impacts on quality of life.
Yeah, definitely.
One of the things I touched on actually was communication support, because this is a really big issue in clinics as well, not least because it varies across clinics. Each different clinic has their own contracts with communication support agencies, and one of the things that's hard to understand is if you don't know, you don't know. So some people are just totally unaware of what communication support is available. There's lots of different communication supports methods that can help different people with different needs, and what we were saying was we want to see a standardized process for clinics. We want them to have a process for recording reviewing and understanding that provision of communication support within the clinic itself. Now, they're all aware of the, you know, the accessible information standard. They're all aware of how to book that support. We see that evident, you know. What seems to be missing is maybe that recording of evolution, you know. I think it's very easy when you're in long-term relationships to sort of not take for granted about how much you know a person. So if you look like the patient and the clinician's relationship, that's, you see each other maybe once a year, maybe more frequently, for one aspect of that person's life. Now, the importance of having a recorded need, also review process, is to manage that need over time and to understand that need over time, because, you know, quite often you will maybe record 5 years ago, oh, that person didn't need support, so that means they don't really need support unless something physical comes up, you know. But actually that choice is not there for the clinicians to make. That choice is there for the patients to make. And so what we're talking about is really having a process that's formalized, standardized across the clinics, that one, informs patients about what they can use, what communication support is available to them, have a review process so it's not all the responsibility of the patient to identify if and when they might benefit from communication support. And again, it's all around choice, you know. It's about putting the responsibilities to the clinical service and saying you need to be asking and reviewing and keep checking whether people want support or not, you know.
Oh man, that's so true.
You know, and for me, I'm a stickler for data, you know, like, how is it recorded? How is it disseminated across the team, across other departments? What's the review procedure? How do you communicate the options? What are patients' rights? Do they know them? You know, so these are just the things we want clinical teams to consider in their processes. We're not telling them what to do. We're not saying you have to do it like this, and this. What we're doing is we're just providing insight into what that's like from a patient's perspective, and we're asking them to consider their process in the hope that they will make the processes more transparent and easy to access.
Oh, can't know what you don't know that I don't know.
Yeah.
That's right.
Yeah, exactly. And you know, I think going back to what I mentioned about everyone needing to know who they're, you know, who they're working with, who they're reaching, this is really important, because again, if the clinics are the main source of information for patients, what good is, you know, a blog post on our website? What good is a blog post on someone else's website? You know, if most of the people with NF2 are actually using the NF2 clinics as the main source of information. Now, the problem with that comes with, if they don't have the infrastructure to be able to provide that information to patients, then it becomes a little bit of an issue. So those are the two campaign points, really, the communication support and the psychological support. Those are the two things that we'll be focusing on this year.
So much of the campaign work is also a learning process for the patients, with the goal of empowering them to stay in independence, feel more in control of managing their lives, and understand the support they are entitled. People to talk about the type of empowerment and how much of a difference this can make to people's lives.
Yeah, that's, you know, that's spot on, really, you know. And I think empowerment is another one of those buzzwords, isn't it? Because actually what some people see as empowerment is actually disempowerment, you know. And I think this is one of the challenges of working across two worlds. So, you know, you have the medical world and the social world. And, you know, sometimes some of the things we talk about mean different things to a patient, to a clinical professional, you know. So it's one of the challenges we have to try and face and communicate with each other. But actually, you know, empowerment at the core of it is giving people the tools to do things and decide things for themselves. And it's the respect that they have the ability to do that, you know, and in a way that works for them and for their needs. And this is why information sharing became really, really important to our future strategy. You know, when someone has a lifelong condition like NF2, there are times in your life where you have zero control over your health, you know. And you have to give over 100% of your trust and control to someone who, in the grand scale of things, you don't really know, but you have to trust that because they're a medical professional, they, you know, have this extensive knowledge around what they're doing and their expertise. And so we trust that. And it's a big ask, but we do that willingly because we know that's where their expertise lie, you know. And you know, where it gets tricky is that there are issues that we face health-wise as NF2ers that are well within our reach to have control over. And, you know, so patient empowerment is really important to educating patients, to making them feel empowered, to be able to take control of the things that they can have control over that are well within their reach, and also vital for self-efficacy, you know?
It's truly amazing how such a tiny piece of information, of knowledge, can make you see things differently or make fundamental changes. Not at just bar.
Yeah, you know, and you can't really put across it, can you? You know, and then most people without health conditions or in other contexts, you know, they won't have that understanding and that insight to know what it feels like to not have the ability to control the situation you're in terms of having the ability to make actual decisions about your own healthcare and actions around, you know, treatment. You know, this is our body, it's our body. That should be our decision making, and we need to have access to that. And there's lots of different layers and dimensions of patient empowerment. Actually, really, the 7 key domains around patient empowerment, but that's a whole other podcast. But the point really is, you know, just things as simple as not having access to information that they can understand can sometimes create this dependency on healthcare services, particularly the NF2 service, you know, and that in itself can be actually quite detrimental. You know, the issue is knowing where the line is between self-management and dependency, because, you know, the fact is, for most of our lives, we are in some form or another dependent on this service. And, you know, actually the benefits of patient empowerment are not just about the patient themselves feeling empowered, but it's also beneficial for the clinics because greater levels of patient empowerment have greater health outcomes because there's a greater level of participation from the patient. So actually, all round, it benefits everyone, you know. So that's really important to us as well.
Yeah, well, this has been so informative, way more than I was expecting. And I think you've made it very clear about the objectives we have here at Can You Hear Us, and also why we have them. So thank you very much for taking the time to talk through this with everyone. I'm so pumped for what's to come after this initiative, and I hope that everyone watching feels the same. So thank you again, Suzi, and we'll be seeing more of you very soon with the upcoming podcasts. Everyone, please remember to hit the subscribe button on the YouTube channel, so that you can be alerted as soon as new episodes are released. Yeah, goodbye.